Anxiety affects millions of people around the world. For some, it's just an occasional feeling of nervousness. But for many others, it becomes a daily struggle that makes it hard to live normally. The good news is anxiety can be treated. Doctors often prescribe specific medicines that help balance brain chemicals and calm the mind. Before we go any further, remember this: always talk to your doctor first. What works for one person may not work for another because every body and brain is different. In this video, we'll explore the top 5 doctor-prescribed medicines for anxiety, how they work, why doctors choose them, and what you should know before using them. Anxiety isn't just about feeling nervous. It's a mix of constant worry, tension, and restlessness, sometimes with physical signs like a fast heartbeat, sweating, or tightness in the chest. Occasional anxiety is normal, but when these feelings happen too often or start to control your life, doctors call it an anxiety disorder. According to experts from Medical News Today and the Mayo Clinic, medicines are usually considered when anxiety becomes frequent, interferes with work or relationships, or when therapy and lifestyle changes alone don't give enough relief. There are different types of medicines that doctors use for anxiety. Some are antidepressants that adjust mood-related brain chemicals. Others are anxiolytics, which directly calm the nervous system. In this video, we'll look at 5 of the most commonly prescribed options, explain how each one works, and discuss what to expect while taking them. Medicine number 1. SSRIs, selective serotonin reuptake inhibitors. Let's start with the most commonly prescribed medicines for anxiety. SSRIs, or selective serotonin reuptake inhibitors. These medicines work by increasing the level of serotonin, a chemical in your brain that helps regulate mood and calmness. According to the Mayo Clinic and research from PubMed Central, SSRIs are often the first treatment doctors try because they're safe for long-term use and have strong evidence supporting their effectiveness. Some popular examples include escitalopram, known by the brand name Lexapro, and sertraline, or Zoloft. They don't work instantly. Most people start noticing results after 2 to 4 weeks. Common side effects can include mild nausea, headache, or sleep changes, but these often fade as your body adjusts. Doctors prefer SSRIs because they not only treat anxiety but also help with depression, which often goes hand in hand. For many patients, SSRIs become a life-changing first step toward balance and calm. Medicine number 2. SNRIs, serotonin norepinephrine reuptake inhibitors. If SSRIs don't fully control anxiety symptoms, doctors often turn to SNRIs, or serotonin norepinephrine reuptake inhibitors. These medicines do something extra. They boost not only serotonin, but also norepinephrine, another brain chemical that affects energy, focus, and mood. According to the Mayo Clinic, common examples include venlafaxine, Effexor XR, and duloxetine, Cymbalta. Many people feel their anxiety and motivation improve after a few weeks, once the medicine builds up in the system. However, some may notice side effects like mild dizziness, sweating, or an increase in blood pressure, so close doctor monitoring is important. SNRIs are often seen as the next step when SSRIs alone aren't enough. They help many people regain emotional stability and reduce the overwhelming physical symptoms of anxiety, like a racing heart or trembling, while supporting better focus and energy levels. Medicine 3. Benzodiazepines, short-term anxiolytics. When anxiety hits hard and fast, doctors sometimes prescribe benzodiazepines, or benzos for short. These are fast-acting medicines that bring relief within minutes by enhancing the effect of GABA, a calming chemical in the brain. Common names include alprazolam, Xanax, and clonazepam, Klonopin, according to the Mayo Clinic. They're often used for panic attacks or extreme episodes of anxiety. However, as explained by Healthline, these medicines come with serious cautions. They can cause drowsiness, confusion, or memory problems, and over time, your body may become dependent on them. That's why doctors prescribe them only for short periods, often just a few weeks. Benzodiazepines can be incredibly effective in calming sudden waves of fear or panic, but they are never meant as a long-term solution. Think of them as a temporary bridge, not a road you stay on forever. Medicine number 4, Buspirone, Next is Buspirone, a medicine that works differently from everything we've mentioned so far. It's not a benzodiazepine, but it still helps relieve anxiety, just more gently. According to Taylor and Francis online, Buspirone acts on special brain receptors called 5-HT1A, helping to balance serotonin in a slower, steadier way. It's a good choice for people who want to avoid the sedation or dependence risk that comes with benzos. WebMD notes that Buspirone doesn't cause drowsiness or memory problems, but it does take time to work, often 2 to 3 weeks before results are noticeable. Doctors sometimes combine it with antidepressants or therapy for a stronger effect. The best part? It's safe for long-term use, and stopping it doesn't cause withdrawal symptoms. Buspirone is like a quiet helper, not instant but consistent, giving people calmness without the heavy side effects. Medicine number 5. Other adjunct options. Beyond these 4 main categories, doctors sometimes use other or adjunct medicines to manage anxiety. According to NYU Langone Health, certain atypical antidepressants like bupropion or mirtazapine can help when standard treatments don't work well enough. In other cases, doctors might prescribe medicines off-label, not specifically approved for anxiety but still helpful. For example, beta blockers can calm physical symptoms like trembling or a racing heart, and some antihistamines can promote relaxation and sleep, according to Doctor on Demand. These options are usually added when anxiety is linked to other health issues or when someone can't tolerate common antidepressants. However, they should always be used under medical supervision. They're not first-choice medicines, but they play an important supporting role, helping people fine-tune their treatment and regain control of their everyday lives. Choosing the right anxiety medicine isn't a one-size-fits-all decision. It's a process. When talking to your doctor, ask key questions, like, what kind of anxiety do I have? Which medicine is best for that type? How long before I feel a difference? What side effects should I expect? Also discuss possible interactions with other medicines, alcohol, or even vitamins. Remember, medication often works best when combined with therapy, exercise, good sleep, and mindfulness. Never stop your medicines suddenly, as that can cause withdrawal or symptom rebound. Instead, work with your doctor to adjust doses safely. Think of your anxiety treatment as teamwork. You, your doctor, and your lifestyle habits working together to bring balance back to your life. With the right plan, progress may be slow, but it's absolutely possible. Every medicine has pros and cons. According to Health Direct, anxiety medicines can cause side effects like nausea, fatigue, dizziness, or changes in appetite. Some may affect sleep or cause sexual side effects. But remember, not everyone experiences these, and most are temporary. The goal is to find the lowest effective dose with the fewest side effects. As noted by the Mayo Clinic, doctors often start low and adjust gradually based on how your body responds. Regular checkups are crucial because your needs may change over time. Watch for warning signs such as increased agitation or mood swings, especially during the first few weeks. And if you ever have thoughts of self-harm, contact your doctor immediately. Medication can be powerful and life-changing, but it must be used carefully. Always follow your prescription and never self-medicate or mix drugs without approval. Let's quickly recap. The top doctor-prescribed medicines for anxiety include SSRIs, SNRIs, benzodiazepines, Buspirone, and adjunct options like beta blockers or antihistamines. Each one works differently, and the right choice depends on your symptoms and overall health. Anxiety isn't a sign of weakness. It's a medical condition that can be treated effectively. Medicines can bring balance, therapy can teach coping skills, and lifestyle changes can strengthen your recovery. If anxiety is holding you back, don't face it alone. Reach out to a healthcare provider and explore your options. You deserve peace, and it's absolutely within reach. If you found this video helpful, give it a like. Share it with someone who might need it, and subscribe for more easy-to-understand health explainers. This video is for educational purposes only. It is not medical advice. Always consult a licensed healthcare provider before starting, changing, or stopping any medication. Everyone's body and mind are different. Only your doctor can guide you safely.